Welcome to the next episode of Mic'd Up with ChiroUp. I've got an exciting lineup of information today. This is going to really be designed to elevate your practice in the next 30 minutes. Now, there is a little bit of a different lineup today, but let me go through the agenda of what we're going to cover. First, personal growth. I'm going to share some ideas that I had from a recent mastermind event. I want to say it completely shifted my perspective. However, it has changed my idea on how to collaborate with your practitioners, with your friends, with the people you graduated with, your email list of people that you look for information. And I really think we need to look into this more to really drive success, not only in your practice, but also, chiropractic as a profession. So I'm going to dive into that a little bit. I'm going to take a deep clinical dive into a critical topic, which is going to be whiplash injuries. I dug down in the research and I found 8 things that really I didn't know about whiplash injuries, and it's going to kind of transform how maybe you approach these patients. I'm going to talk about a go-to orthopedic test that's not only going to identify key metrics for whiplash disability, but also is going to help track your patient progress, kind of show them how they're progressing. I'm going to show or talk about how to make informed decisions about imaging. This is one of the biggest things. I don't want to say mistakes, but a little bit of a question mark in your brain on whether you should be imaging these patients after an auto accident or any kind of whiplash injury. And then finally, treatment frequency, one of the biggest things that we talk about in the chiropractic profession. What should we be doing for these patients to help improve their long-term outcomes? And then finally on this agenda, I'm going to go through a little bit of a personal story to kind of wrap up the podcast. I'm going to share with you a real life story about my 15-year-old son, a youth soccer player. I've done some blogs on him, some baseball stuff, but really one of the interesting things that he experienced while starting Accutane. And I think this is one interesting story that really, obviously, we're not going to talk about parenting so much on this podcast. However, this medication actually impacted his performance and really his musculoskeletal health. And I kind of want to share with you a new research study that we just posted in ChiroUp. And I think it may impact maybe your OPPQRST to kind of understand what your patients are going through. So this episode is going to have it all. It's going to have some personal growth tips, some clinical pearls, some relatable stories. So hopefully all these things can help you resonate with your patients. So let's take the next 30 minutes. Let's really dive into these stories, because I think this is going to maybe improve the way we practice with definitely the clinical skills. But also really taking a deep dive into that history to make sure we understand all the components of patient care before we get started. Now, as always, just a reminder, if you haven't yet hit the follow button, share this episode with a friend. It really does help us reach more people and more great DCs like yourself. I really appreciate those people that not only do share our podcast episodes, but also provide feedback. We did a survey recently and got a lot of feedback on this podcast. So if you ever have any more feedback, please email me, Brandon@chiroup.com. I'd be happy to not only answer the email, but also, take the format and mess with it a little bit as far as this podcast, because this is another outlet that we can use besides our blogs and our webinars to help reach you and provide the content you're looking for. So today, before we dive into today's clinical content, I want to share with you a recent experience I had at the Modern Chiropractic Marketing Mastermind. And over this weekend, I had the opportunity to engage with an incredible group of chiropractors. And it was a group of about 20 or 30 people, but they were all dedicated to really enhancing the patient experience. And these weren't the same office. These were people who had no staff, people that had 20 staff and seeing 250 new patients a month. I mean, this is the gamut of chiropractors. The conversations were inspiring. The educational takeaways, my notebook is full of notes. And I thought to myself, maybe I was missing out these last couple of years. I've been somewhat anti-mastermind because of my past experiences where I pay to go to a mastermind and then I'm just sold to all day long. So I paid to get sold to, and this was different. And by no means am I, I have no financial relationship with MCM. However, I was just inspired to provide this information because I don't think everyone needs a formal mastermind. However, I do believe that we need a group of, let's just call it influential, intelligent, successful chiropractors to bounce ideas off of. And I think successful is a big term here because I'm a part of a group called EO, and you have to have a certain number of employees and financial status to be part of this group. That doesn't mean that it's some pecking order or people whose opinions are more important, but you have to be able to show that you've done it. And this is a group that definitely has done it and is looking to get better. And I think after 15, 16 years in practice, I'm still amazed by the new information and how fresh ideas can surface when you really just engage the right people and you ask the right questions. So my challenge to you is to reconnect with former classmates, reconnect with a technique group or strong-minded, chiropractors in your area. Participating in a mastermind if that's something that floats your boat. But surround yourself with the right kind of minds that are going to benefit you, but also in return benefit your practice and then of course your patients. I think that from a personal standpoint, let's face it, sometimes being a chiropractor can kind of feel like you're on an island sometimes. You make decisions, but you don't know if it's a good decision or not until, you've had a little bit of time to test it. So I think that when you can share with other people candidly about your victories and your challenges, and you can feel understood, then leave that conversation feeling energized, and more importantly, with actionable ideas, really is going to go a long way in helping yourself. I will say that all those things have changed my mindset even this week back in practice, and I'm kind of excited to get back into practice. I also, on a side note, heard a really good joke from the waiter at the resort. Why do melons get married? They can't elope. So I do love just a really terrible dad joke at the wrong time. Just kind of breaks the tension. Anyway, I hope that means something to you. If it doesn't, then I apologize for wasting a little bit of time on this podcast. But it was important to me. And if you can share any other masterminds or groups or groups of chiropractors that get together, that are like-minded, send me an email. I'd love to learn about these groups that we have in our profession and somehow learn how to bring those together and just get the best kind of ideas for the profession. Now, let's dive into something a little more clinical, with a little more, let's call it clinical meat. Whiplash. So I do see a lot of PI cases in my practice. My associate probably does see more, and he has a great relationship with several attorneys in our area. So I really wanted to dive in and foster those relationships. So the meat of this podcast is going to go over some things that we have learned about whiplash injury through the research, but then also some personal stories that I think may help you develop these relationships with attorneys, and then, of course, manage these cases. Great. So, I mean, really, whenever I think about cervical acceleration, deceleration syndromes, which oddly enough, this is another personal story, but I was in a seminar and someone asked me, would you manipulate people with CAD syndrome, CAD syndrome? And instantly my brain went to carotid artery dissection, and I went through like 3 minutes of how we would, in a professional way, would not be manipulating that. And then I was, corrected that we're talking about cervical acceleration, deceleration syndromes. But here's the deal, is that when it comes to any kind of an motor vehicle accident, any kind of MVA, is that 83% of people that are in any kind of accident have whiplash injuries. And this is one of those things that, I think that if we can understand this, when these patients walk in the door, this is going to dramatically impact how you treat this patient. So first off, as far as the things that I dug down in the research, is that whiplash is more than neck pain. And I know we kind of know that. However, sometimes patients are kind of limited to neck pain, but this is a multi-system injury. Symptoms can include, headaches and dizziness, and TMD, I see a lot of jaw pain, cognitive issues if there was, any kind of a concussion associated, tinnitus, even lower back pain, because this is one of those things that we see lower back pain just as prevalent as neck pain in our auto accidents. So in the research, 31% of MVA victims also experience chronic lower back pain a year post-injury. These are things that we can be armed with to help our patients, of course, prevent those things. With that being said, the second piece is that 50% of whiplash patients report persistent symptoms after a year. That is unreal. 60% of patients develop long-standing issues, and symptoms can sometimes persist for 20 years after whiplash. Now, these are all stats. I can give you the references if you like. However, this is something that should be stuck in the back of your brain, that unfortunately, after these kind of incidents, people can suffer symptoms for not just weeks or months, but really for years. So that should go into your patient education and dive into that biosocial model is finding the cause of their pain, but also talking to them about this and getting them out of their symptoms. Number 3 was a lesson I learned from actually an attorney, is that low impact collisions, even below 5 miles an hour, can cause significant whiplash syndrome. Now, one thing that's good to know, and obviously we want to protect our patients. However, one thing I did in my notes is I would always put in the note the patient was rear-ended at 10 miles an hour, or they were hit at 50 miles an hour. Well, it turns out using those numbers isn't great for an attorney, and really your patient will suffer from that. So one tool they helped us with is saying they were hit at a high speed or a low speed, and using some more generic terms and not putting the exact numbers, because obviously your patient doesn't know exactly how fast that other car was going. All right, number 4, seatbelts. Now, you can't, I'm going to give you some information. However, I still want you to wear your seatbelt. Please wear your seatbelt. However, just because seatbelts save lives, they can actually exacerbate cervical spine injuries. And the reason I bring this up is, one, absolutely 100% wear your seatbelt. However, an improperly adjusted head restraint in a seatbelt can actually increase the risk of injury, because they kind of act as a fulcrum in those rear impact collisions. So make sure you note if a seatbelt was worn, is what I'm getting at. Number 5, prognostic factors for poor recovery. And these are things that are important for your note, because if a patient is going months without seeing substantial improvement or slow progress, these are things that if you had in your initial note may significantly help within your note, but also when they settle the case as far as why it took so long to get that patient to recover. So if they have severe or early symptom onset, if they have a neck disability index above 15, if they have pre-existing conditions like neck pain, headaches, or any kind of DJD, and of course, if they have any kind of psychological factors like depression or PTSD, and pain catastrophizing. So these are things that, and definitely with our survey system, no matter what, I mean, if that patient's putting on any kind of neck symptoms, we're automatically asking them the neck disability index, asking them for other system issues. And then, of course, putting a yellow flags questionnaire in your initial paperwork. And so many people don't want to keep on giving your patients all this paperwork. However, if you have a survey system that can automatically ask those questions if they were an auto accident, like we do with ChiroUp, and I'm sure there's a lot of other services that do that, those are going to help you and your patient in the long term. So make sure you do those things. Next, gender and head position matter. Women are always at a greater risk for symptoms, and some people always ask me about that, and I do believe there are some biomechanical factors associated with it. However, and this would be another personal opinion, women take care of themselves better than men. We know that. Women have 22% more diagnoses than men, and it's not because they have more problems than men, it's they take care of themselves better than men. Men will wait and say, oh, it'll be fine, where women will actually go in to see the doctor. But also, with that being said, height and seat differences will change the vulnerability of that person in the car accident. And then keep in mind head position. As far as a rotated head will actually amplify injury severity and recovery time. So make sure you get those things in your note. What were you looking at the time of impact? And then the number 7 part, were you aware of what was happening? Because patients who are aware of an impeding collision actually fare better. People bracing, kind of like, I'm about to get hit by a car. They do have less pain and injury severity compared to those who are caught unaware. People who are unaware are 15 times more likely to experience persistent symptoms. Now, I'm throwing out a lot of numbers here. The numbers here are not just random numbers. Please dive into that condition reference section in ChiroUp, and all the references are in there. So you can see where those numbers came from and the exact research articles. And the reason I say that is because if you're going to go talk with an attorney like we do with medical doctors and attorneys where we have lunches with them, we bring up those numbers. Those numbers are not marketing for why that attorney should be sending me patients. They're good. I mean, it positions me as a thought leader, as obviously someone who's in tune with the research, but those are the numbers they can use to help themselves. And let's be real, when you go see a medical doctor, when you go see an attorney at one of these lunches, while everybody likes a free lunch, really what kind of value can you provide to that professional in 5 to 10 minutes? They're going to not only remember you, but you're going to help them do their job better. So that's where these numbers come from, and something that we use both in those talks, but these are also the things we include in our newsletters. We do a quarterly attorney newsletter and monthly MD newsletter to show those different offices and professionals where we do share a demographic of patients to say, hey, we're looking at the same things. How can we help you, do your job? Obviously, I wouldn't put that in there. By no means should I be giving any kind of lawyer any kind of legal advice. Now, the number 8 thing, the number thing that the 8th thing about whiplash injuries is the thing that I already knew. However, I will have to say that I think I do a really good job, but I could probably do better, is those validated tools like the Neck Disability Index. Most of us are really good about asking that the first time. Please, please, please make sure that you ask those on re-exam visits, and make sure you use the same disability index. Don't give the Neck Disability Index the first time and then switch it up to the low back, probably OSWESTI or a dash score, or whatever it may be. Use the same one you started with, because we need to, of course, document things for the musculoskeletal system, but we also need to be able to use these tools to address psychological factors and predictors of recovery. Now, before I get into a couple of things that I do for whiplash patients, I do have a quick question, and that is, are you reading our blog? Because I heard from our marketing team that there's segmentation. The people who listen to the podcast don't read the blog. The people who read the blog don't watch the webinars. And it's interesting because that's kind of the reason we did these podcasts, is because they're kind of extensions of the blog. So for those of you who don't know, just for those people, that demographic, we do put out a blog every single Monday, really over the last 10 or 11 years. And it's become the most popular chiropractic blog in the world. How cool is that? And it's mostly clinical stuff. We have some great topics. Dr. B just put a one out on brachioradial pruritus, which was a huge hit, something I've never even heard of. However, something that is going to help me in my patient care in the future. And then we also did a top roundup of the research of the year. And then I just put out a blog really using the company Practice Sync with Evan Gwilliam, just a titan in the profession as far as billing. And we talked about proper billing techniques for different codes. And so if you're not getting those emails on Monday mornings, don't worry. Just go over to ChiroUp /blog and subscribe, and you'll be able to get the clinical information in text format. So go take a look at it. It's worth it, I promise you. Now back to the podcast. I want to go over my favorite go-to orthopedic test for whiplash patients, and it's the deep neck flexion test. And this is one of the tests that I think will help you understand the compensations. And these patients with any kind of acceleration deceleration injury, they exhibit weakened deep neck flexors. And they often will substitute those deep neck flexors for overactivation of things like the SCM and the upper traps. And unfortunately, this imbalance contributes to pain and dysfunction and slowed recovery. So this deep neck flexion test, what our patients are going to do is they're going to tuck their chin in, and as they're picking their head up, we're going to time it. And we're going to see how long can you actually tuck your chin and then pick your head up off the table from a supine position, really activating and using those longest coli, longest capiti, those deep neck flexors. And if they're not able to hold that position, you can correct it. However, trying to see how long they can do that. Men, about 40 seconds, women, about 30 seconds as far as averages. But you're going to see a lot of patients flunk out of this test because, one, they can't do it because of pain, they can't hold that position, or they start shaking. And this is a good objective baseline metric to monitor progress, because pain, as we know, is one metric. A disability index is another metric. This orthopedic test, if done at the first visit and then done at the re-exam, can help demonstrate objective improvement. So something that I would definitely take a look at. You could look at the video in ChiroUp to show you exactly how to do it. This is different, though, than the cervical cranial flexion test. So I think that's one of those things that when you just pick your head up from a supine position and see how they move is different than the deep neck flexor strength test. So make sure you know the difference between both of those. But this really is a game changer. It really creates maybe a tangible way to demonstrate improvement over time. So something you should consider using. I told you I was going to talk about imaging, and I think this is one of the things that I really use more in my clinical prediction rules. I use the Canadian C-spine rule whenever I do any kind of imaging. So I think this is one of those things that auto accidents, if that were the case, or trauma, the 5 things that really go through my brain is: 1, dangerous mechanism of injury. If that's the case, I'm going to image. Anybody over 65, I'm going to image. Individuals with midline cervical tenderness is there, but I'm going to need a couple more of these to be positive before I just image everybody. Any kind of radiating neurologic symptoms, I'm going to image. And then the last one is any kind of significant loss of range of motion after a dangerous mechanism of injury. And my number is 50%. I think that's what the American College of Radiology said is 50% also. I could be off on that. However, those are my 5 things. Now, absolutely, 100%. If they have red flags like cancer, bone disease, any kind of inflammatory condition, steroid use, those kind of things, or maybe prior surgery, yes, we're going to image those people. I will say, and this is more of an opinion, not a fact, if I have someone who has, progressive, prolonged pain, that they're not getting better in the first 3 to 4 weeks, of course I'm going to image those patients too. It's my right to do that. I need to help protect my patient. Whenever I do or have any kind of trauma, I will do flexion extension functional X-rays if I do think there's some kind of segmental hypermobility. Obviously, hypomobility could be identified on that, but that's not usually going to be my North Star. If I have hypomobility of a joint, that doesn't mean I need to X-ray someone. But if I suspect hypermobility, of course I would. Next piece, treatment frequency with the whiplash. Here's the deal. And I know chiropractors get a bad name for over-treatment, but this is one of those. Early and frequent treatment is crucial from patients recovering from whiplash injuries. It offers the best chance of positive outcomes. Studies show that addressing chronic whiplash, addressing chronic whiplash, meaning if they've already had it for 3 to 6 months, you're getting limited success, minimal symptom improvement, and you've had this patient. They've had symptoms for a year, and now they come in to see you. They're just not going to be a fast responder if they're a responder at all. So something you really want to think about. I think this is something we really need to take a multimodal approach, including education, exercise, early mobilization. You could, of course, use the Croft Whiplash Treatment Guidelines. It provides if you want to use that in your office, a comprehensive schedule of treatment, frequency, duration, tailored to kind of the severity of trauma after you grade it. It really will help you deliver optimal care. But keep in mind, we really want to get that patient back to their normal activities of daily living as fast is possible. And I think that if we can do that on a regular basis for these patients, we can help the vast majority of them recover from this injury, whether it's an MV or not, as fast as humanly possible. So that's kind of, I want to wrap up the Whiplash piece. Those are the 8 things that I kind of learned about Whiplash. I threw some numbers at you. I threw some attorney marketing at you. I threw an orthopedic test at you and some treatment frequency. If you have any other questions on that, please let me know. But those are the biggest pieces. If you get into the condition reference section in ChiroUp, you're going to see a lot of references in there. Those references are extremely important because we can now take the current research and show exactly how great we are at treating this condition. Now, it's kind of changing gears here. I want to go into, really this would be more of a personal story. And it's a personal story that I want to bring up because it affected me as a clinician, but also I think it probably affects each and every one of us if we ask the right questions. And the personal story I want to share is these kind of surprising, I guess, connection between the acne medication Accutane and musculoskeletal pain. Now, Accutane is pretty popular. It's very popular in the high school. It's not as popular as big baggy t-shirts and joggers, which is really kind of interesting. I talked to my kids. I don't think my kids wear a pair of jeans. It is 2025. Do people wear jeans anymore? Anyway, the topic that I want to go through is this 15-year-old athlete. So an avid soccer player playing 3 to 4 times a week, but he did start Accutane during the season. I wrote a podcast on this, but I wrote a blog on this, but a new research article just came up that I want to bring to your attention because it just kind of hit me again, is that within weeks of taking Accutane, he began experiencing significant calf pain, hip flexor pain, quad pain, and it was unexpected and concerning. He had Sidney Larsen-Johansson in his younger years. He had a little bit of Sever's disease because of overtraining. As a chiropractor and as a parent, I kind of found myself in a unique position to help him during those situations. But really, right now, this was kind of multi-joint, multi-system, and I was pretty concerned. And we kind of adjusted his training load. Adjusted, a little pun intended, did some adjusting also, but we adjusted his training load and kind of focused more on his recovery strategies. We also took a look at BPC. There's some pretty good research on BPC. I won't get too much into that. However, we focused on his recovery strategies, really gave him some rest, and he didn't get better. In fact, he just kept on getting worse. We had an appointment with his dermatologist, and we were assured there is no connection between Accutane and musculoskeletal pain. But let me bring to you a paper that was just published this year. This was a systematic review published in Dermatology Reports. It does shed light on this issue. The study investigated musculoskeletal complaints associated with isoretinoin, I'm sorry, I mispronounced that, and found that back pain, myalgia, arthralgia, and even sacroiliitis were common side effects. Back pain was the most frequently reported symptom affecting, get this, between 41 and 74% of the cases. Symptoms could appear as early as 15 days after starting the medication and sometimes lasted years after post-treatment. So, this is an interesting study, linking the cumulative dose of Accutane to the development of our patients that can really create severe side effects and particularly lower back pain. And for my son, something a touch different. There's also serious complications, sacroiliitis and DISH, diffuse idiopathic skeletal hyperostosis. I think that's right. Diffuse, hyperostosis. We're also documented in there. So as chiropractors, we obviously need to be aware of the potential side effects when treating all of our patients, but our young athletes who are going through a lot of changes and also changing medication use. So take a thorough history. If you're ever getting symptoms that don't quite make sense, we really want to make sure that we dive back into that OPP-QRST and say, hey, maybe I missed something in the first visit. What other things could be causing symptoms? So understanding medications like Accutane caffeine can have a huge impact on the musculoskeletal system as far as causing symptoms. And also keep in mind things like diabetes, things like thyroid disease, alcoholism, B vitamin deficiencies can slow down healing. So those are other things that we need to be thinking about, that if we have a clear understanding of our patient's condition, we can help provide better information on on their care, and also what's about to happen. Are they going to heal fast, or maybe something systemically is causing their symptoms? This podcast was really kind of fun to take something I learned, something I did some research on as far as clinical content, and then something as far as a personal story to put together. But if you want to hear other things in the podcast, let me know. That's what we're doing this for. I mean, if you enjoyed this episode, like I said from the very beginning, please share this with a friend, a colleague that you think is going to be inspired by this information. And if you find it valuable, share it. If you didn't find it valuable, send me an email and tell me why, so we can make it better next time. This podcast is all about pushing our profession forward, and you can help us spread that message by, of course, once again, hitting that follow button. I really appreciate the feedback. I appreciate the people following this episode, and I'll come at you again next month.
Hey, thanks for listening. To access more information, visit ChiroUp.com. You can sign up for a 14-day trial. Use referral code PODCAST15 for a special discount after your trial. Offer valid on new subscriptions only.